Good morning, everyone. Welcome to a new session from Planet X Live. Today's session is in partnership with Doctors Without Borders, and we will talk about COVID-19 vaccination efforts and challenges with our guest, Dr. Isabelle Defourny, Director of Operations at Doctors Without Borders in France. Welcome to Planet X, Dr. Isabelle.
Thank you. Good morning.
We would like today to talk about the vaccination global efforts against COVID-19. And I don't think of a better one than you, who is working in the field with the people, with the doctors and the healthcare systems, to tell us what are the issues that you are facing regarding COVID-19 vaccination.
So there are different situations in different countries, of course. So in the countries where we are working, the vaccination is starting. It's the beginning. So we are really involved MSF in vaccination campaign only in Lebanon, in a nursing home. But it's, of course, for us, vaccination is the most important topic, in fact, on this epidemic. So we are trying to support on different ways. So what we see in countries, so as I said, different situation in several countries in Africa. The main problem that we see is the hesitancy of population, the interest in vaccine. We can come back on that because it can be understandable in countries where, in fact, the pandemic is not so severe and it's not the main problem. In other countries, we saw insufficient quantities of vaccine. We can come back on the COVAX mechanism, for example. And in other countries, what we see, it's a lack of funding of the vaccination campaign, which is another problem. So maybe just to summarize briefly.
I'm muted because of the echo. So a question here, because I have read a lot about how vaccines got expired because of the fear of the vaccination and the hesitancy of people. And what should countries do, governments, some journalists like myself and people who are watching us? What do you think is how we can help people get over their fears about vaccine?
No, it's true that hesitancy is, it's a very important barrier in some country. But so different point. I think it's important to realize that this hesitancy was or is still high almost all over the world. I have the experience in France. The French people, they were the most reluctant to vaccination in Europe, I think. And it took months to convince the medical staff, even the medical staff, to get vaccinated. So it's a reality. It's explained because of, it's explained, I think, by the fact that it's a new vaccine. And also it's explained, I think, mainly because of the kind of chaotic communication on the side effects. It's important to realize that, as I said, it's a new vaccine. Data are extremely new, and to give on time the right information to the population, I think it was extremely complicated, but it's extremely important. I want to come back. I think in countries where the epidemic is not severe, like for example, we are working in Niger. There is almost extremely few severe cases. I think we can completely understand the hesitancy of the population. COVID is not, you don't see anybody dying from COVID. Yourself, you are not at risk at all because you are young, even if you understand that the vaccine is safe and the side effects extremely infrequent, I think it's understandable that people wait a bit to get vaccinated. The hesitancy, we see that the hesitancy is less and less frequent when the epidemic is increasing, of course. But I think there is a specific effort to do on the explanation on the side effect of the vaccine, and it takes time. It has to be repeated many times. For me, I still have a problem, and I have still difficulties to explain to the population why in certain countries, like in Europe, in US, for the young population, for the people younger than 50 years old, we use this new technology, the vaccine with RNA messenger, and why in a country like Africa or in other countries of Middle East, we will use AstraZeneca or Sinopharm for this young population. I think it will help, in fact, to have more or less the same criteria all over the world. I see in different countries that young people are more keen to get vaccinated with the messenger RNA vaccine because it's those policies that are followed in countries like US. So yeah.
Okay, so like we were talking in the backstage, and we were talking about how frustrating it is. Some people are, they don't want to take the vaccine, when some people like don't have even access to the vaccine because there's no, what we call it, fair allocation for the vaccine and its distribution. So let's talk a little bit about what is fair allocation of the vaccine is, and why there is inequality of distributing it worldwide.
Yeah. It's a complicated, it's a long question, but okay. But just to come back on the previous question, to me, as you, I'm really convinced that people with risk factor to a severe form of COVID, if they have the opportunity, they need to get the vaccine. We saw, and myself, we saw in many different countries in our project, people dying from severe form of COVID, and so it's extremely impressive, and it's the only way to be protected. And just to come back, there are some discussion on the efficacy of the different vaccine, but the vaccine protect against the severe form of this disease, which is what we are expecting. If you get a very light COVID, bon, at the end it's not a big problem. What you want is to don't die, don't be hospitalized, etc. And the vaccine proved their efficacy on the severe form of COVID, which is very important. So on the allocation of vaccine, so where are we today? Because where are we today? So today, I think you see a different announcement from the US government on the fact that the president of USA is in favor to lift the patent on vaccines, and it gives us some hope to increase the production of vaccine. So, at my opinion, maybe this announce will be very positive in a long term on the production of vaccine, but on the short, mid-term, for the coming year, I don't think that will be the solution to have more vaccines in country where there is not enough today. I think that we have no choice. Some countries reach or will reach in the coming months of a good level of vaccination of the population at risk. Not all the population at risk. So I think we can estimate that the people at risk in a population are about 1/3 of the population. If you take the old people with risk factor, the medical staff, etc., it's more or less 1/3. So when a country severely touched by the outbreak, like in many countries in Europe, for example, when a country will reach about 1/3 of its population vaccinated, I think it will be non-understandable to continue to vaccinate people not at risk when in other countries the most vulnerable people won't have access to the vaccine. So I think for the coming months, maybe the coming years, there is no choice to share the vaccine and to have this priority to make accessible the vaccine to the people at risk of severe form of disease. So there are many and that has to be done, so we will see. But there are some pressure on. I just saw this morning that the US, they decide to send 80 million of vaccines out of US for different countries, which is a good news. We will see what Europe will do, etc. China and Russia, since the beginning, are exporting some vaccines. But this question of a fair allocation of vaccine is a question between the country, a worldwide question, but it's also a question inside the country. So it's also a political decision inside each country to make sure that the vaccines are used for the people who really need this vaccine, at least in priority. So voilà, it's after we are following what is happening months after day, month after month, and try to put our small influence on that debate. And what we are doing, for example, we work also in practice. For example, we are working in Peru, and in Peru has a very high mortality rate, one of the worst in the world. But they receive vaccines, and they are very well organized. So and they are able to distribute those vaccines as soon as they receive the vaccine. So we work with them. We start a discussion with the US government, with Pfizer, to see if there is a possibility to increase this volume of vaccine for Peru. So we will see what will be the result, and we are working like that with different countries with this idea to make known the situation of those countries, to increase the quantity of vaccine. Voilà.
I think it's a good step from the US because of vaccine nationalism and hoarding vaccines to vaccine your whole population 2 times, like what Canada did, for example, and Japan. I don't think it was very responsible action. But there are the initiative, you talked about it, the COVAX initiative for fair allocation and distributing the vaccines. But is it that successful? Because sometimes I feel like something is hindering. I was talking to one of the WHO, and they said the bilateral deals done by the governments of rich countries with the pharmaceutical companies are hindering their efforts to gather the needed doses for the other nations. So what do you think about the COVAX efforts on the ground?
But yeah, it's an interesting initiative, but it's true that until now there are not so many results on the ground, but just because they don't have enough vaccine. In fact, they get the funding, so they have enough money, let's say, but what they are missing is the quantity of vaccine. So and it's a fact, it's like that. The WHO, the UN, they don't have the power to force any country to give their vaccine, or they don't have any power to force the pharmaceutical industry to allocate the vaccine to the more needed countries. So they completely depend of the willingness of the countries to share the vaccine, and they depend on the level of production of the vaccine. I think the situation will change because so during this first year, and still now, the level of production of vaccine is insufficient to meet the needs. But that situation will change. You know, in the US, I think it's half of the adult population who receive minimum 1 dose of vaccine. So they are more comfortable on the way to control the epidemic. So they will start to share the vaccine and to export the vaccine. I think it will be more or less the same in Europe. Those countries will have to share their vaccine since they get a possibility to control the outbreak in their own country. And the production of vaccine is increasing. So I think that the situation will change, and soon the problematic that we will face will not be anymore a problem in the quantity of vaccine, but will be the problem of distribution of those vaccines. So we will come back on the question of hesitancy, funding, and organization of vaccination campaigns. So the COVAX, the COVAX is missing his own stock of vaccine, I think, and is highly dependent on the production and on the willingness of donation of vaccine. Yeah, which is still problematic, but hopefully, I hope it will change with a higher level of production.
So one another question that I'm really curious about most of the time, that robust healthcare systems are struggling sometimes in well-developed countries to roll out the vaccine distribution and the vaccination process. And I was wondering, what does the countries in conflict areas and our healthcare systems in conflict areas and failed states like Lebanon, for example, are doing to distribute vaccines and vaccinate their populations? Do you have, I would love to hear your insights from the field.
Yeah, I think, the main difficult things for countries in war or where with a failed health system, the main difficulty is the management of severe patients. So the hospitalization of patients with severe form of disease. It's always the most difficult part of medicine. The hospital, extremely demanding of human resource, high competency. It's extremely costly, etc. For the vaccination, we see less difficulty in a country like Yemen, for example. Unfortunately, there are other outbreak. We saw in the past measles outbreak or cholera outbreak. So for cholera, we did not vaccinate. But what I want to say is that there is in fact some habit or expertise to respond to emergencies, and we see that in Africa, for example, in many countries in Africa, there is a kind of habit of organization of vaccination campaigns. So I'm not sure that will be the most complicated part. But in Yemen, for example, we discussed in South Yemen, we discussed with the authorities, with WHO, and we realized that the vaccines are paid, are financed, the vaccines are coming, the cold chain is there, but there is no budget for the vaccination campaign itself, for the organization and the budget for the human resource, etc. So it's something that we want to support also. Yeah. The organization of the vaccination campaign depend also of the type of the kind of vaccine on the cold chain. When it's done with the usual cold chain, I think with some support, but in many countries it will be. I think it will be manageable. Yeah.
So I would like to ask you from your work in the field about a very tough situation that you've faced about vaccination in one of these conflict areas, and how you handle this situation. Like we heard, for example, what happened in India and how the healthcare system were flooded with cases, and they didn't have like oxygen to help the severe cases. Have you faced some sort of this situation, and how you help the healthcare system to handle it?
Yeah, it's not. Yeah, the tough situation that we face are because the lack of vaccination. It's because people are not vaccinated. So one of we have team MSF. We have some team working in India, but something that was very impressive. It was the situation in Yemen. So the first wave in Yemen, it was during the last summer. So it was a very brutal increase. So from the impression, it was from one day to another, almost no severe cases, and the days after, hundreds of patients hospitalized, even young patients, people 40, 50 years old, so not very old people. Arriving at the hospital in extremely high need of oxygen, so we were able to set up an hospital with more or less 100 beds, but the mortality reached 50%, so very high mortality. Half of the people arriving very late, needing a very high level of oxygen. It's something very impressive with this disease. It's the level of oxygen that one patient needs. So again, there is for the moment a second wave in Yemen, and more spread in the country. The first time it was in Sana'a and Aden. This time it seems to be spread a little bit everywhere in the country. So in a country like that, and we see also an extremely severe situation in Baghdad. In Iraq, it's only in Baghdad we saw severe cases, but in Baghdad, also young people arriving very late, high level of mortality in the hospital, in the ICU. So in a country like Yemen, for example, but it will be the same in every country, if we don't hurry to implement the vaccination, it's sure 100% that we will have a third wave. And on the top, I think on the top on this existing situation, it's true that the situation in India is also very worrying. New variants, possibility also to spread. It's already the case out of India. So we don't see any other solution than to speed up the vaccination of population in countries that were already severely hit by the disease, in priority in those countries. I think, as I said, the production of vaccine is not yet sufficient enough to vaccinate the entire world, but I think today, with the number of vaccines that we have, and we could vaccinate the population at risk in countries where the epidemic is severe. There are certain countries, fortunately, where the epidemic is not yet very active. And in Middle East, we were involved different time in Jordan, for example, but the government managed to take in charge of the situation. There was some fear in the last month, but the number of cases was not so high, and the number of people who get vaccine is increasing. So the situation seems to be more or less under control. We are worried by the situation in Iraq. The vaccination is starting, and situation in Yemen. And after Syria, still extremely complicated to get the right data, to have a clear idea on the situation in Syria. Voilà.
So one of the things about conflict areas that there are no like precautionary measures are taking, so the numbers are high and the rollout of vaccination is low, and I think this puts a lot of pressure on organizations like Doctor Without Borders to do more. What do you think international organizations should do to help people in these areas?
To help the people working
in conflict, yes, in conflict, working in conflict areas, or how do you think is the best way to handle countries without precautionary measures, without rolling out the plan for the vaccination of their population? It's a very difficult situation, and international organizations are trying to do their best to help these people. How do you think is the best way to help healthcare sectors, for example, in these countries?
But it's true that when there is a conflict in a country, it makes everything complicated, difficult to follow the different measures, but also difficult, for example, just to access to the hospital. We are a bit worried by the situation of the COVID in Palestine, for example. Today, today with the situation in Israel and Palestine, we will see, but most probably the effort on vaccination will be a little bit on hold. So I hope we will see how the epidemic will evolve. But in fact, I don't know exactly what to say, because especially in conflict areas, the vaccination is essential. I think it's the only way to protect the population, especially when you know that the access to healthcare is extremely complicated. So how to be protected? It's, I think, only by the vaccination. Yeah.
So about the vaccination and the role of science journalism, how do you think what have you read recently? Have you read recently a piece of news that made you angry about journalists and how they cover such topics that made your mission is a little bit harder?
Oh, I don't have an example. I don't have an example like that. And in the contrary, I think there are many good article papers that explain the question of vaccination and encourage the population to be vaccinated after how to counter, rumors, fake news, etc. That's not easy, and how to explain, how to give simple but reliable, and exact information. Because for me, that's the difficulty. Long paper, scientific paper, etc., are very complicated to understand for not specialized staff. But how to give to the population real information, but also simple, understandable, and that's not easy, because there are more and more information on the Pfizer and Moderna vaccine, RNA messenger vaccine. There are also information on the AstraZeneca vaccine, and we know the debate on AstraZeneca. The Sinopharm vaccine, for example, was just registered and registered by WHO, so it's extremely new. So during months and months, it was a reality that all of us had very few information on this vaccine. I'm not saying that it was not a good vaccine, just the fact that you had few information, so some difficulties to respond to the question of the people. So so information to the population, reliable, exact information, etc. And after, something else that I have also in mind is that something which is already missing. It's sometimes information from the government on the number of cases in the country, real data, number of hospitalization, number of cases of death, of hospitalization, number of people vaccinated. That is also something extremely important, and we see that, and it's understandable, but this pandemic, this epidemic is in some countries extremely sensitive, politically speaking. And what we see sometimes is the real difficulty, even for us, to get some exact data on the number of cases, number of people vaccinated, and that makes very complicated to follow the situation, to understand the epidemiology, to understand who needs to be vaccinated first, etc., etc. So I think there is also an needed effort from some of the government. For some, the data are very good, but for other government to communicate on the data, on the figure, on the number of the epidemiology.
Yeah. So may I ask you, Isabelle, for how long have you been working at Doctors Without Borders?
I started in 1999.
Okay, so this is how 20 years now. So it's been a long ride, right?
Yeah.
So you have seen many challenges along this time. Do you see that now you are meeting the same challenges in camps, مثلا, in the refugees camps or in the conflict areas as from 20 years ago, or the challenges have changed a bit?
No, of course, there were many different changes in 20 years. No, I'm trying to put my ideas. No, I think that fortunately the situation with extremely high mortalities are less frequent than before. You know, in the 80s we met. I have the example of Ethiopia, for example. People arriving in desperate situation and with extremely high mortality, even among adult populations. So the level of mortality and the medical management of the person, the quality of the drugs, of the vaccine, etc., is improving. I think the nutritional status of the population also is improving. But what is extremely complicated with the refugee population, it's also the condition of living of the refugee in the long term are still extremely basic, extremely understandard. The lack of perspective for the future is extremely complicated. So even I think the number of people who die in movement in refugee camp is a bit lower than in the past, but the difficulty of being a refugee, of living in a camp, with the question on the future and still a level of assistance which is still with a low standard does not change so much.
So after know for how long you worked for Doctors Without Borders, I'm so curious to know, why did you stick for for this long? Why did you stick at your position at Doctors Without Borders for that long? Is it passion? I'm curious to know. It's a very personal. It's outside the vaccination thing, but I'm really curious to know, because some people just can't stand to stay at the same place for like 5-10 years. So I want to know your secret.
No, but I move a lot and I change. I don't know, many times of position. No, but I study medicine in Belgium, and I start to work at in an hospital. In an hospital, and after a few years, I was a bit. I get a little bit bored just to see the wall of the hospital, to stay in the same hospital, in the same corridor, etc. I really wanted to move, to travel, and try to do something a little bit useful. And when I discover MSF, my first I thought that I was in fact very, very lucky to have this opportunity to travel, meet different people, work with so many different people that you arrive in their life, in their country, but they accept you. You work with them, you learn so many things. So in fact, I work with the same organization. I work for 5 years with another organization, and I came back to MSF, but not always in the same country, not always in the same position. And I'm still very interested, and I continue to think that it's a real chance to be able to go to Yemen, to go to Mali, to Peru, etc., to practice medicine not only in my small country in Belgium, but be able to continue to continue to learn, discover, and to continue to move. Me, I like to move also.
This is very nice. I think you are enjoying what you are doing, and it gives you the chance to see the world in the real time and event.
Yeah.
So about COVID-19 and the vaccination thing, it's it's very, you think it changed millions of people's life, and it changed the normal life we used to know. I need to know from you a situation. Tell me a situation you were in the field, and it changed a little bit inside of you because of COVID.
It changed a little bit, sorry?
Inside of you personally, while you were working in the field. A situation with doctors, or what, something you have done or you have witnessed happen that changed you in a way during COVID.
During COVID. No, I think I don't know if it changed me, but what I see, and I'm very sensitive, and I think it's like that all over the world. This epidemic is extremely complicated for the medical and paramedical team. And I saw in the different field, in the different country, MSF team of teams from the Ministry of Health, etc., how hard they are working. They are working day and night. I don't know if non-medical realize that well, but it's in the intensive care unit, in the high dependency unit of oxygen. The level of mortality is about 40–50%. So one patient on two is dying. You are working night and day, and your medical and you lose one half of your patients. So it's extremely complicated, but they continue. I can tell you that all of them, they say, why people don't want to be vaccinated? Because when they see the young people coming in the hospital in very severe stage. So, and that is the challenge for us, for the medical team. After 1 year of pandemic, people are extremely tired. Medical staff in the hospital, etc., are extremely tired. So, but we need to continue. They need to continue. We are trying to see how to replace them, etc., etc. But I'm a bit worried on how long those teams will be able to continue to work like that, and that's why we try to push like you, like others, on the urgency of the vaccination.
Mm-hmm. Okay. I think we have come to the end of our session. I will check the comments. Most of them are wishing Doctors Without Borders good luck, because of, I think you are doing really hard work right now during COVID-19. All the healthcare sector are doing a lot of efforts, and for that we are all grateful. Thank you, Dr. Isabelle Defourny, the Director of Operation at Doctor Without Borders France. She was with us today. Thank you for coming to Planet X Live, Dr. Isabelle.
Thanks to you.
Today's session was in partnership with Doctor Without Borders. Thank you for watching, and hope you enjoyed the session, and goodbye.
Goodbye, thank you.